Welcome to the VET S.O.S podcast. Thank you for joining us for our 4th anniversary show. Remember, as always, don't drown in the sea of transition. Grab the VET S.O.S Lifeline. As we celebrate our 4th anniversary, we knew we had to go big. We had to produce something that would, really stand out for this year. And, I think we delivered this time. I think this is going to be good. So each of our anniversary shows has had some sort of special guest or special announcement or what have you. Today, absolutely no exception. Today, we are sitting down with Tim Admire and Fitha Dahana-Ellis from the Wounded Warrior Project. So excited to have Wounded Warrior Project on here. And they're helping us celebrate our anniversary and kick off our Memorial Day week of releases, all focused on the Wounded Warrior Project. So prepare yourself to learn a lot about what WWP does for our community and how you can use them. We've told you before, get out the pen and paper. You're going to want to just keep it by the computer, keep it by the phone, wherever you're listening, because this is going to be just a week full of information for you. So make sure you're taking some notes here and make sure you're using their services because they offer so much. It's important that you get out there and use it, because that's what they're there for, right? They're there to help us and as veterans, so we need to get out there and use it. So I'm excited to be riding shotgun with my partner, Keith. Happy anniversary, brother. How you doing today?
I'm doing well, brother. Happy anniversary to you too. And just like any good marriage, I've learned to nod, smile, and let you think you're in charge. So I'm doing great.
And I appreciate that. It's good to think I'm in charge in all aspects of my life, knowing that I'm not in charge of anything.
I just, like I said, I just show up and try to provide the comic relief.
Like a good husband over several years, I've learned my role.
Exactly.
All right. So we're sitting down today with Tim Admire. He's a mission-driven professional with more than 2 decades of experience supporting veterans and military families through data-informed advocacy and direct service. A combat veteran of the Iraq War who served as a chaplain's assistant, Tim has dedicated his career to walking alongside service members and their families during some of life's most challenging moments. For the past 10.5 years, Tim has served as a warrior support coordinator with Wounded Warrior Project, where he found his true calling, his brothers and sisters in arms, and the families who stand beside them. Known for his empathy, commitment, and deep understanding of the veteran experience, Tim is passionate about ensuring no warrior feels unseen or unsupported. Outside of work, Tim values time with his wife and 4 children in Jacksonville, Florida, and this is where my empathy comes in. He is a diehard fan of the University of Georgia Bulldogs. I have learned over the years to get along with everybody. So, I'll behave myself during this podcast and as we go, despite the whole bulldog thing. Fitha, she serves as a veteran advocate with the Wounded Warrior Care Network at Wounded Warrior Project. There's a lot of W's in this, where she connects veterans and their families with critical mental health resources, a featured speaker at national conferences, including AVECO, VFW National Convening, and Delaware Mental Health Summit. She has dedicated over a decade to advocating for military families across the country. As the spouse of a disabled veteran, Fitha brings both professional expertise and lived experience to her work. Her unique perspective drives her commitment to breaking down barriers and creating pathways for healing that transform the lives of veterans and their families. How are you guys doing today?
Take a sip of water while they talk. Holy cow. That was a lot.
All right. So, David, how are you doing today? I'm sorry, Tim, how are you doing today? I keep going back to David. Sorry about that. Tim, how are you doing today?
I'm doing well, brother. I'm doing well. How are you?
Not too bad, man. Not too bad today. Yep. I corrected Tim everywhere except right there. I caught myself. All right. So, Fitha, how are you doing today?
Fitha?
Can you hear us? So we all stare awkwardly at the camera. All right. Well, Fitha. Oh, we got animals.
Try to talk.
We can't hear you.
You're on mute.
As she works on that, Tim, let's jump into your transition story. So how did your transition out of the military go? Let's enlighten us to that before we jump into talking about your role there at Wounded Warrior Project.
So I spent 8 years in the U.S. Army. I got out December of 2013. Right around that time, I asked my dad actually, going into I say June or July. I said, my ETS is coming up, and I asked him that, I was like, well, I can either, re-enlist or, because I really want to spend time with my boys, my two boys that I have. And because we come from divorced family, all that kind of stuff. So spending time with them is one of my top priorities. And he said, well, he's a 23-year Navy vet. He's like, well, how do you feel about getting out? I'm like, well, to be honest, I have no idea what I'm going to do when I get out. And he said, well, you've done the firefighting thing, you've done the EMT thing, you've done the, military thing. My advice would be to, do something less dangerous and spend time with your boys as a father. And, that's the advice that I took. And, I got out, December 2013.
Yeah, and I think all of us can relate to that to a degree, right? And I know Keith and I have had these conversations numerous times about the importance of family and how,
Yep.
especially once we got out, it was about, family first and really, making up for as much lost time as you can. And I applaud you for that. It's important to,
Mhm.
jump in there and be there as a lifeline for them and to support the
Mhm.
boys, especially as they grow up. So,
Yes, sir.
Fitha, can you hear us now? You can hear us, but we can't hear you.
Still can't hear you. Yeah.
We're going to do this whole thing in sign language.
We had you earlier.
Yeah, we had her a minute ago.
And she doesn't have the mute button on.
Yeah, I'm not sure what's going on here, except that Murphy showed up today. Okay, so while we continue to wait on Fitha to work on her mic, Tim, tell us a little bit about your role and what you're doing in Wounded Warrior.
So the Resource Center is a multi-channel communication hub for the whole organization. A lot of times that is your first your first access and your first contact with Wounded Warrior Project.
Okay.
As a warrior support coordinator, my job is to triage calls that call in, and we can get pretty much anything from homeless to suicidal to looking for financial, looking for benefits assistance. So our calls could really mean anything on the other end. So my job is to kind of triage the call, listen intently, and then actively put in either get them registered with us or get them connected with our programs, resources, teammates, stuff like that. And then to, as I'm, doing all that, to record everything, and get it into the system so that when that warrior or veteran calls back, they can pick up where we left off as talking to me. So it's very well recorded, through the system, and it's just about listening to them, giving them a voice. So that's what I do on a daily basis.
Very nice. Fitha, do we have you now? No.
What in the world?
She's trying.
Yeah. If I was still drinking, we could play a drinking game with this.
Oh,
there she goes.
she's trying again. So Tim, tell me, like, that's got to be like a heavy, like what you're doing sounds heavy to me, like just emotionally heavy. Like, so, these service members, do you find that when they call, they're very open, like they're at that point where they're just ready to be open with somebody, or do you feel like you have to build their trust? Because we don't tend to be a very trusting community out the gate, at least. Like, what's that dynamic like?
So great question. It could be really mixed. a lot of the veterans calling in, they see the logo and they see the, they see the big organization that's been here since 2003. So they're kind of ready to open up at that point and trust the logo. And that's our job, to kind of keep up that precedence and keep up that trust. Other times the veteran calls in and, they're not quite ready to open up. And that's when you gotta, go into your emotional support skills. And kind of, trust them to kind of open up. And the good thing about us is there's no timeline on the call. Other call centers, you call in, it's like, hey, I've got 10 minutes with you. What's going on? How can I help you? With the resource center, it's, I've had calls where they last 2 hours. Just talking to them and getting them to open up. I've had warriors that are on social media, talking to them on Facebook, messaging them back and forth. And I've literally spent all day talking back and forth with them. So we have that versatility, we have that flexibility on doing that. And just being a veteran myself, I'm kind of, listening to their story and kind of peeling back the onion, as we like to call it, on really what's the root cause of what's what's bothering them or what's going on in their life. It's just that having that emotional intelligence and that emotional support kind of element, on getting them to open up and, getting the help that they need.
That's, I can only imagine. Well, no, I guess I can imagine to a degree, because we've had some great conversations on here, and just through some of the mentorship calls we've had, Keith.
Yes, sir.
We've had some serious conversations too, but the conversations that you must have, and what impact you're having with them must be just absolutely amazing. A 2-hour call, an all day interaction, over social media, just to build those connections and let them get everything out that they want to get out. And I mean, it's got to be so therapeutic for them, and really applaud your efforts for that, man. I'm glad that we have people like you at the Warrior Project that are willing to, make that commitment, and not be like, hey, I got another call, got to go, and actually just get into the weeds with them. That's fantastic.
Yes, sir.
Yeah. So, so obviously, you talk to the service members and veterans that you talk to, and then you don't talk to the ones you don't. But I'm just kind of curious, like, what's your perspective or perception on the difference between a warrior who reaches out and one who doesn't? Like, what's that point that they hit that where they come to you for assistance?
Yeah. So another great question. My perception, I mean, I'm each call that I get, I'm very proud of the warrior up front. I didn't immediately reach out when I got out. A lot of the warriors that call in is, I mean, I get a lot of them where they'll call in and say, I'm not, I don't have any, limbs missing or anything like that. I'm not like, what's in the logo, but, I don't know if I'm, able to talk to you guys. And I'm like, well, no, we're Wounded Warrior Project. I mean, each wound is, and, not all wounds are visible. So I'm very proud of the warriors for reaching out, whenever I pick up the phone. The guys that don't reach out, I can completely understand. And I hope that, they listen to this podcast or hear our commercials, that we really, really want to make a connection with you. We really want to talk to you. Even if it's something that you don't know that you're reaching out for, like you don't like, I don't know what I'm reaching out about. I don't know where this is going to go. Like, just have a conversation with us one-on-one. It's just you and me, veteran to veteran. civilian to civilian to veteran. Let's talk. Let's get through things together and go from there.
That's yeah, man, that's just fantastic. So walk us through the process, so I pick up the call and I make that first phone call, and you pick it up. What's that look like, and how does that start the process of getting me involved in Wounded Warrior Project and what they have to offer?
Yeah, it's a great question again. So the process starts. You call in and say you're looking for financial assistance or you're looking for mental health assistance. The first steps would be to get you registered as one of our alumni. It takes about 10 minutes usually. Get all your information, get your service information and stuff like that. And then get you saved into the system. Our registration team will email you we'll email you within probably the next 3 to 5 minutes after everything is saved in the system. So you can reply with your DD-214, ERB, ORB, anything that has your service dates on it, if you're active, and then get you connected with any of our programs that we have. Say you're looking for mental health assistance. So usually about a 4 to 6 business day process to get you approved. We can at times ask our registration team to expedite that if needed, and then usually get a referral over to our mental health triage team. 3 to 5 business days usually for them to reach out. A lot of times it's sooner than that. And then what we do is we have a massive database of organizations in our resource center, our database that will send you the resources for, say, financial or service dog or whatever you're looking for. And then for you to reach out to them, and then our mental health triage team will reach out to you, get you started on their programs.
Yeah, okay. I think that works pretty well. I mean, I know when I registered with it,
Mhm.
it all went really smoothly, and just how you laid it out there. And
Yes, sir.
what? Thanks for joining us today, Fitha. We're complete. Well,
Can you hear
thanks
me
for
now?
yeah, we can hear you.
Got it.
I'm so sorry. First
That's all
time
right.
using a computer. I don't know what's going on.
So,
Oh boy.
um,
Okay.
no, Tim was just letting us know about the process. So like if I were to call in,
hmm
what's that process look like? But let's jump back to your story, Fitha, and you're a veteran spouse. Is that the main reason that you decided to continue to work with veterans and their families, or are there other driving factors there? We'd love to hear your story of, how you got to working with Wounded Warrior Project.
Yeah. So I was living my best life in Hawaii. And I met my service member husband. He was at the Army. He was at Schofield Barracks. And before I met him, I was working in marketing, public relations. I back in Indonesia, back in the day, I hosted like a TV show, kind of like all these things. So I always thought my life was going to be marketing, public relations, kind of in that field. And then I married him, and then we got orders to Fort Campbell, Kentucky. I don't know if you're familiar with Fort Campbell, Kentucky, but
It's a little different than
it's
Hawaii.
a little different. It's a gigantic base between the states of Tennessee and Kentucky, right? And I call that area Tennessee because
Oh,
compared to
wow.
Hawaii, it was just terrible. I couldn't find work. As someone all of us, I'm sure here, have worked since we were in high school, right? I couldn't find work. There's no marketing and communication offices in Clarksville, right? And so I applied for work, and I just could not find work, and it was super frustrating. And I remember it was kind of like really dark time in my life because I had two babies in diapers. The only thing that I had was that. My husband was always in the field and kind of the things that Army people do. Um, And then also at the same time, he was starting to show symptoms of what we call now, kind of PTSD. Back then it was 2011. We didn't know, right? And so he was just showing these signs and symptoms. And, I would ask him, "Hey man, are you okay?" And of course he would answer, "Oh, I'm fine," right? All the time, "I'm fine, I'm fine." And then we had we had what I call the incident. And basically it was, in my mind, it was super dramatic. I don't know if it really was that dramatic, but basically, there's like a loud bang in our garage. This man jumped over me in bed, and he's like, "Yo, grab the M4 and follow me." He did that whole thing, and so I followed him around the house. Of course, we don't have an M4, so I didn't grab one, but I did have my cell phone on me. So I followed this man kind of room by room as we cleared the house. First time clearing a house, obviously. Room by room, he was saying things like, "Keep your head on a swivel." I don't know. And he'd be all like, "Clear." I'm like, "Okay, I don't know what that means." But then the last room was my mom, and she was sleeping. I can really laugh about it now because I've probably told this story a million times, right? But in that moment, I was in my own head catastrophizing, as one does. It was like, okay, wow, we're going to accidentally shoot someone who's just walking their dog in the middle of the night. Because this was like at 1 a.m. or something like that, right? And I was fully just in my mind, where he's going to go to prison. I'm going to end up homeless under a bridge with two babies. Like, I mean, my mind was just going crazy. The last room that we went to was my mom who was visiting. So he, flashlight in her face. "Are you okay?" She wakes up like she's in a horror movie, like like that. And then he's like, "Go back to sleep." But he traumatized my mom a little bit. But then afterwards, we finally were able to chit chat. And then he's like, "Yeah, okay, maybe that is something. Maybe I'm wound a little tight." And I felt really relieved that we were finally talking about it, but also really overwhelmed, like, okay, well, what do I do now? But the world works in mysterious ways because I ended up going to ACAP, is what they used to call it back in the day. It's now, I think, Soldier for Life, right? Um, and Wounded Warrior Project was there briefing, and they were briefing on their mental health programs. And I sat in that room and I just started crying because for the first time in like such a long time, I didn't feel alone. I knew that I could lean on them to help me find work. I knew that, kind of like all these things, I didn't feel so isolated, that I had been feeling so isolated. And I remember I promised myself two things. I was like, okay, I'm going to, number one, register my husband. And it's crazy because, back then too, again, 2011, everybody thought to be part of Wounded Warrior Project, you had to be missing a limb or physically injured, which is not the case at all. So, there was some reluctance, of course, from him. He's like, "Yeah, I made it back okay. I have all my, I'm complete." And so I registered us. And when I say us, I mean him, because I had a copy of his DD-214. I just registered. Now, family members can actually register without their spouse. Back in the day, allegedly, apparently, I did that without consent. But that's neither here nor there. And I promised myself I was going to register him. And then the second thing I promised myself was I was going to work at WWP. And about like almost a year to the date of that, I was on a flight back to Hawaii, where I spent my first 5 years. And during my time working with, Wounded Warrior Project, I actually finally got hired also at ACAP, um, kind of working with transition service members. I really enjoyed that job much more than I did working on this marketing and public relations. Like, I always felt like in that field, it's hard work because, oh, we have a shoot, everybody's got to be there at 4 a.m., whatever. It's kind of, but I never fully felt like fulfilled. It was just kind of, yeah, it's busy work. This is fun. We get to party. Um, but I found that when I was working with transitioning service members and also with Wounded Warrior Project, it was just, it filled my cup. And so this is my 12th year at WWP, and I absolutely still love it. I'm part of the Warrior Care Network team. So what I do is I do outreach specifically for Warrior Care Network. So I go around the country kind of talking about the program, and it's a free 2-week program for veterans, active duty service members, reservists, even some people who can't qualify for VA services can go to our programs. And it's been really cool to just travel the country and meet other teammates in different places, meet other veterans who finally end up going to Warrior Care Network treatment, and really seeing how it changes lives and saves marriages. And so it's just been such a wonderful, humbling experience to be part of this organization. And I am thrilled to be still working there.
Well, we're thrilled you're working there too. And I got to tell you, I don't know that I've ever heard the spouse tell the story. That was fascinating to actually hear that from your vantage point. And I'm so happy that you can laugh about it now. So that, to me, I'm assuming then that your husband's received help, he's doing better, and that's why
Yes.
you can laugh about it now.
Yes.
But yeah, I can only imagine the emotions you were going through at the time and what
Oh
that
yeah.
looked like. But definitely applaud your efforts for what you're doing and how you're helping us, and for even helping us set this up. I'm so happy that we get to sit down and do this, and I'm glad we got the microphone working.
Yes, me too. First win of the day. Microphone works. I can hear. Have coffee. Everything's fine now.
There you go. There you go. Right up your alley there, Keith, huh?
Right. So, I it was funny because I was laughing along during the story, and before you even kind of mentioned the joking part, like I thought to myself for a split second, like I shouldn't be laughing at this, like, like,
It's
but
actually
again,
terrifying,
it's
right? Yeah.
right, yeah, but it's just it's that dark humor, right, that
Yeah.
we embrace in this community. So, just out of curiosity, like, how do you find what's the word I'm looking for? Like the boundary, right? Or where you draw the line between like
What
that humor
boundary?
piece,
What boundary?
right? Or is he just just an open book, like for all to read? Like,
Uh,
like where do how much the personal side? Because the advocacy and vulnerability piece is huge, but I'm assuming there's still a little bit of a private life you want to maintain.
yeah. Yeah, absolutely. It's been interesting, especially when I was working in Hawaii. I don't know if you're familiar with Hawaii, but it's like a very tight-knit community. Like I knew all the warriors. We we were connected on social media. Some of our kids went to like dance practice together. It's really hard. It was really hard for me to separate kind of like my personal life with my WWP life living in Hawaii. But from that experience, I did get a bunch of really, really good friends. And I what this organization is really good with, also with its teammates, is it really prioritizes also kind of our mental health, especially working on a mental health team. And just through that experience, I've learned how to have those better boundaries. I've learned that I can't do it alone. I lean on my teammates a lot. I lean on other programs. I know I can now identify quickly when, okay, this is not something that I'm going to be able to help with. I'm not going to be able to provide the most help for this warrior. Let's, I'll send them to a different program or a different teammate that might be better suited for that warrior. And yeah, it's a case by case. It's really interesting, but yeah, it's you really get connected. Like I've lost now several obviously warriors to suicide, and it's just really hard not to take it personally. But ultimately, I know that what I'm doing is helpful, and I just got to keep moving on and helping as much as I can. And I have to be aware of what I can do compared to the other things out there that I have no control over. I hope that answered your question. I think it did.
No, absolutely it did.
Okay.
No, it's great insight. So since 2015, over 300,000 hours of clinical care, right? More than 5,000 warriors assisted. And in 2024, I haven't seen 2025 numbers, but 2024, $100 million invested in programs for depression, anxiety, substance abuse, and so how do you even build from here? Like, where do you two see this going in the next 5 years? Like, where's the growth going to come from?
You want to start, Tim?
Um, yeah. So, we have a new CEO, Walt. He's a retired 3-star. Very, very passionate, very down to earth. I think that his vision is to bring on as many warriors as possible, and get him connected to our programs and stuff like that. I really think that we're going to grow exponentially, from here. And I don't know if Fitha, if you have anything to caveat on this, but
Yeah.
I really see us growing.
Yeah, absolutely. I know on the mental health side, I can definitely speak to Warrior Care Network.
Mhm.
We know that there are other warriors out there that don't even know about their program. That's probably the most interesting thing. Like Sean, when I met you, I think it was the same thing. It was like, yeah, I know about Wounded Warrior Project. Oh, you have this, whole portfolio of mental health programs. So one of the things we're trying to do is just reach out to more of these warriors, reach out to them where they're at. We've been targeting a lot of active duty bases as well, family members, National Guards people, speaking at these different conferences. But I know in terms of resources, because right now Warrior Care Network has 4 academic medical centers that we work with. And so what we're trying really hard to push also is virtual care. So there's this treaty called SIPAC where providers can practice over state lines. 43 states right now are in SIPAC. So
Mhm.
providers in Chicago can provide care here to Florida, to these different states. And so we're leaning really on that. And also, what we've been trying to do is we've been trying to educate a lot of the providers on how to do this accelerated treatment program so that they can provide it themselves. Like I know we Project Odyssey, which is another one of our mental health programs, which is really cool. It's hard work, right? A lot of people I think hear Project Odyssey, oh man, they're going to take me hiking, all these whitewater rafting, but really you're working a lot. It's a lot of hard work. You're really kind of picking at that scab, if you will, of all the emotions in the hardest days of your life.
Mhm.
We've been teaching a lot of chaplains, on active duty chaplains, on how to hold their own active duty Project Odysseys, and that's been really effective. And I think that's really the big key. We can't do this alone. We know there are so many warriors out there that need our help that maybe for whatever reason uh, aren't able to register at WWP, don't know about us, and the community partners that we make. Like we work really closely with the VA, with the vet centers, and I think that we're gonna, just like Tim was saying, we're gonna grow exponentially. We're gonna reach out to all these different people that need us, and then we're also going to keep working on our programs to make sure that we're able to support them.
That's
Yeah.
awesome. No, absolutely incredible work what y'all are doing. And unfortunately, we're not even at time. We're over time, but so we gotta wrap this up. But Jerry Springer's show, I always like to give it back to Sean for his final thought. So do you have anything to add before we have to wrap this up, Sean?
Oh man, I love this organization, all the work they're doing, and I'm looking so forward to sharing all these episodes with the audience and really getting into the different areas, several of the different areas that Wounded Warrior Project does. So thank you both for the work you're doing, and thank you for joining us today.
Yeah, no,
Thanks, guys.
absolutely.
Yeah.
Great way to
Thanks,
kick off
guys.
anniversary week. So but I do have one last question, quick one for both of you. So how do folks get in touch with y'all?
Resource
You can call
Center.
the Resource
Yes.
Center. Yep. Call the Resource Center at 1-888-997-2586. You can live chat with us through our website, and you can also send us a social media message, whether it's Facebook, Twitter, Instagram, TikTok, any of those channels.
Awesome. So you're on all the socials, and
Yeah.
Yes,
our
sir.
folks can pause and rewind to that phone number one more time because I didn't write it down and I didn't memorize it. So, no, but thank you guys so much for joining today. It's been absolutely awesome. And on behalf of the entire VET S.O.S family, we'd like to thank everyone for spending their time with us for our 4-year anniversary. It's always great having everybody along for the ride. Don't forget to
Yay.
check out all of our other episodes and keep coming back for more stories, insight, and support from the VET S.O.S crew. And if you enjoyed this episode, give us a follow, share the show, and tell a friend or two. Toss your battle buddies, fire team, shipmates, and wingmen that flotation device they need in transition so no one drowns in the sea of transition. And as always, grab the VET S.O.S Lifeline.